Hey guys, this is Dr. Joe Borio with this week's Thought Flash. Hope you guys are having a great day. Listen, today we're going to talk about a lot of great stuff, and we're going to talk about how to communicate during evaluations, like new patient evaluations. Before I go there, I want to tell you, if you weren't there, you missed a great event. We were in Las Vegas with Dr. Matt Hubbard, Dr. Eric Croucher, and we talked about chiropractic, we talked about the passion and certainty, we went over the science, we went over technique, we talked all about how to get your practice growing, blow the lid off your practice. And I don't see that enough. And I want to see excitement in you guys and be pumped up about what it is we do every day. And Dr. Matt Hubbard certainly brought that energy to the table. I'll tell you, it was an honor to have him there. So big thanks to you and big honor to you out there, Dr. Matt Hubbard on the West Coast at CORE. We've got a great event if you missed Vegas. Huge event, life-changing, awesome life-changing event coming up to March 18th and 19th. It's going to be in Chicago, Illinois. So check our website, make sure you get on there, sign up for that. We only have so many seats in the venue that we're registered, so we certainly like to get as many registered people there as we possibly can. Today what we want to talk about is value on evaluations. What the heck does that mean? This is what I've seen a lot of times. I see docs come in and I have them show me their evaluations, just show me their exams, and I'm not liking what I'm seeing. What I'm seeing when they do the eval is they're walking people through these evaluations and they're not expressing value to what they show them. And what happens is when the person leaves the evaluation, they don't realize that they have some significant problems with their spine, with their health, with their nervous system. So we need to be the ones to explain it to them. And how the heck do we do that? We got to do it by expressing value before they begin an exam. So I can tell you straight out, when I started practicing, before I even had the money to buy a lot of this stuff, I had a bilateral weight scale that I bought at Kmart. Okay? I bought a mirror from an auto glass shop up the street here in Cicero, and I put tape on it. And lo and behold, 20 years ago, that's the same mirror that I had 20 years ago in practice, okay? But that being said, still works. Look at that, huh? I think I paid like $30 for it, 25 bucks. But in any case, here's the mirror. Here's my bilateral weight scale on a SAM unit that we use, okay? Now, when you bring people up there, how do you do this simple with value, okay? You express to them what you're looking for when you do the evaluation. So by that, a lot of docs will say, okay, why don't you come up here? Let's do posture, for example. I'm going to have you stand up here, Linda. I'm going to see what your posture is like. I want to see where you're leaning one side or the other, where your body's crooked. Okay, go ahead. Well, do you see how your right shoulder's lower? Do you see how your head leans to that side? See how your body presses on that side? Yes, yes, yes. Okay, well, okay, that shows that the body's crooked. Your spine's crooked on that. All right, let's check your range of motion. All right, you see where you're limited here? Show me where it hurts. We start talking all these symptoms, right? Let me ask you guys a question. No disrespect, but does it really matter if this hurts versus that versus that? I mean, who cares? So why even evoke symptoms? You want to assess function, equating that to health. So you want to assess not where it hurts. Let's see how well you can move, where the spine is stuck, where it's out of alignment. And I'll get into that in a minute. But most docs are certainly just lean forward, tell me where it hurts. Where it hurts, who cares where it hurts, right? And then we're doing the bilateral weight scales, trying to see, well, I want to see where you're leaning 10 pounds, 20 pounds heavier to the one side or the other side. Oh my God, I want to cry when I hear that explanation. Listen. You want to demonstrate value, you want to demonstrate concern, you want to demonstrate something's very significant when they're moving around on a scale, when you're looking at range of motion, when you're looking at posture. Because that posture, that change in them is killing them. You got to understand that. You got to feel right with that. You got to have the science to back that up in your head and your heart so that you're able to convey that and communicate that. Your staff has to know that if they're helping you with the eval. And you want to have an autonomic nerve chart. I got one right here, and I got one right there. So I got two autonomic nerve charts right in the room so they know exactly what's happening, okay? So what's going to happen here is they're going to stand up. Let's say you're checking posture. Now, before you even check posture, you want to say to the patient, now listen, Bob, what we're going to do here is we're going to check your posture. Now, posture is the window to the spine. What does that mean? Basically, Bob, anywhere where the spine is crooked, if you remember when we talked about the pre-consultation, the brain sends messages or signals down the spine and out to the body organs. So when the spine's crooked, when it's out of alignment, what it does is it presses on nerves. A simple way to check where your spine might be out of alignment, where it may be subluxated, is to check your posture, okay? So let's do that. When they stand there and you check your posture, you see the shoulders lower. Bob, you know your right shoulder is significantly, you don't say severely, if it's low, it's significant. Your right shoulder is significantly lower than the left. That's a concern, Bob. What's happening to those nerves? Bob's going to say they're being pressed on. Where do those nerves go? You immediately turn them over to here. Well, that nerve goes to my heart and lung. What's happening to the messages there? They're being shut down. What's happening to the organ? The organ's getting sicker. You get it? Stop telling them everything. They'll start getting it by you asking questions. Less messages to the organ. What's that mean? Well, the organ's probably getting sick. Exactly. What does that mean? Well, I'm getting sick. Exactly. Something we certainly want to take a close look at. I'm going to let Dr. Joe know that, or if you're the doctor, I'm going to certainly make note of that, and I want to pay particular attention to that when I do x-rays or thermography or whatever. So everything that you do for the patient, for that member, when they come in, has to be pre-established for value. You have to say to them, explain to them what it is you're doing, why you're doing it, and what significance you're trying to pull out of that evaluation. That's what you're trying to get out. Anything less than that, and guess what? You're doing some push-ups. All right? You gotta get on with what we're describing, because now what they do is they go, now imagine this, they do your thermography that way, they do your weight scale, they do your range of motion, they do your x-rays or whatever, and you're expressing value and you're showing them there's significant findings with everything you're doing. You're asking them questions about the autonomic nervous system on their first visit, and they're like, wow. They're gonna walk out and say, I'm crooked, the messages from my brain aren't going to my body, and I'm getting sick or diseased. That's what they're going to walk out with. They're going to walk out with at least essentially that as an understanding of what's wrong with them. And they're going to know that what you do now has value. It's significant. They're concerned. They're vested. They're going to want to make sure they get back in on that next visit to find out what you found. And when you tell them, hey, look, I found this, this, and this, and I'm very concerned, and this is significant, and this is a problem, and we need to get you in, and we need to make sure that your spouse is here so we can review this information for you, they're going to be much more compliant because they understand that there's value, there's significance. Listen, if their spine is out, if they lose posture, let's close with this. If their head's out in front and they're doing this, they're dying. End of story. You got the Journal of Spine, you got the Journal of Geriatrics, you got the a Mayo Clinic. They're all coming out with studies showing that the spine's forward hyperkyphotic, hypolordotic in the neck, or even worse, reversed. What are you doing? You're compressing neural fibers in the spine, you're demyelinating the spinal cord. The upper cervical technique docs are showing that it's affecting cerebral spinal fluid flow, fourth ventricle, venous stasis in the brain, which means more toxicity, which means I'm more likely to get dementia, Parkinson's, Alzheimer's, multiple sclerosis. They're saying it may not even be autoimmune now. Now they're saying it might be totally related, or a good portion of the cases are related to forward head posture, which means subluxated spine, which means posture is significant. It truly is the window to the spine and is something that can kill them. But so is thermography, so is surface EMG, so is a platinum system on the foot pressure, so is an x-ray. You got to express the value to them. They're going to understand that what you're doing is very important, and they're going to want to know the results of it, and they're going to be much more motivated to take your recommendations. That's it, man. That is great information for you to implement in your practice immediately. Listen, guys, don't forget, March 18th and 19th, I want you to register for what? We want you to register for Chicago. I want to see that place jam-packed full of chiropractors that want to blow the lid off their practices. I want to see you blow the lid off and serve as many people as you can for the number of years that you have in practice, to add that number of years back to those people you serve. Listen, this has been Dr. Joe Borio, this week's Thought Flash. Remember, serve those people well. Put them in front of your own needs. Make sure that you come from a place of service. May your innate flow from above down, guys. Have a great week.
My best friend gave me the best advice. He said each day